The syndrome of impaired carbohydrate, fat, and protein metabolism caused by either lack of insulin secretion or decreased sensitivity of the tissues to insulin. There are two general types of diabetes mellitus, type 1 diabetes mellitus and type 2 diabetes mellitus. Type 1 is insulin dependent caused by lack of insulin, whereas type 2 is non-insulin dependent and it is caused by decreased sensitivity of the target tissues to the metabolic effect of insulin, that is insulin resistance. Some of the signs and symptoms of diabetes, various manifestations develop because three major setbacks of insulin deficiency. One is there will be increased blood sugar levels due to the reduced utilization of the tissue. Second one is mobilization of the fat from the adipose tissue for energy purpose, which elevates fatty acid content in the blood, which leads to atherosclerosis. And third one is depletion of the proteins from the tissue for energy utilization. These are some of the differentiating features of type 1 and type 2 diabetes mellitus. In type 1, age of onset is less than 20 years, whereas type 2 it is more than 30 years. Body mass is low to normal in type 1, whereas type 2 diabetes mellitus they are obese. Plasma insulin low or absent in type 1, where it is normal or high initially in the type 2 diabetes mellitus. Plasma glucagon is high and can be suppressed in type 1, whereas in type 2 plasma glucagons they are high and resistant to suppression. Plasma glucose are increased in type 1 diabetes mellitus and also in type 2 diabetes mellitus. Insulin sensitivity is normal in type 1 but reduced in type 2 diabetes mellitus. The mode of therapy in type 1 is usually the insulin, whereas in type 2 it is mainly done through the weight loss, thiazolidinones, metformins, and sulfonylureas and insulin. Some of the clinical features of diabetes mellitus are polyuria, polydipsia, polyphagia. Polyuria occurs due to the osmotic effect. More water accompanies the glucose, whereas polydipsia occurs to compensate for the loss of water, where thirst center is activated and more water is taken, whereas polyphagia occurs to compensate the loss of glucose and protein. There can also be glycosuria, osmotic diuresis, asthenia, that is lack of energy, ketoacidosis or acetone breathing, Kussmaul's breathing, and coma. The difference between diabetes mellitus and diabetes insipidus is given in the table. The diabetes mellitus is deficiency of insulin secretion from the pancreas. Lesion will be in the pancreas, whereas diabetes insipidus is deficiency of ADH secretion from posterior pituitary, and the lesion will be supraoptic nucleus of the hypothalamus. Major metabolic changes in diabetes mellitus are storage of glucose and glycogen in muscle is impaired, the liver glycogen breakdown is increased, fat breakdown is increased, ketone bodies formations are increased. In diabetes insipidus, no such effects. Urine output is large and urine is voided, which is called as polyuria. In diabetes insipidus, the large volume of urine is voided, that is also called as polyuria. The cause of polyuria in diabetes mellitus is water reabsorption is prevented by the osmotic pressure effect of glucose in the lumen of renal tubule. So more water is lost through the urine, whereas in diabetes insipidus there will be ADH deficiency which decreases the water reabsorption at DCT and collecting duct, so more water is lost. In diabetes mellitus, the presence of glucose in the urine and the glucose is absent in diabetes mellitus. The taste of urine is sweet in diabetes mellitus and it is tasteless in diabetes insipidus. Specific gravity is high in diabetes mellitus and the specific gravity is low in case of diabetes insipidus. In blood glucose, there can be hyperglycemia in diabetes mellitus. It is normal in diabetes insipidus. There can be ketosis in diabetes mellitus, where it is not seen in diabetes mellitus. Symptoms of diabetes mellitus are mainly the increased thirst, hunger, ketonuria, poor wound healing, whereas the increased thirst is the main symptom of diabetes insipidus. Treatment of diabetes mellitus is mainly by oral hypoglycemic agents and insulin injection, whereas diabetes mellitus or insipidus is treated by ADH injections. Some of the complications of diabetes mellitus are it predisposes to the infection. That is, intracellular glucose are converted to advanced glycosylation end products, and these end products interfere with leukocyte response to infection. They also lead to atherosclerosis. They lead to diabetic neuropathy, causing degeneration of autonomic and peripheral nerves. So they causes diabetic retinopathy, where you can see degenerative changes in the retina. There can be diabetic nephropathy, where it leads to degenerative changes in kidney. It can also lead to end organ damages like stroke and myocardial infarction. Treatment type 1 is mainly through the administration of insulin. Type 2 is by diet control, exercise, that is to induce weight loss and reverse the insulin resistance. If this fails, drugs are administered to stimulate increased production.